a very warm welcome to our question and answer session on managing anxiety during a coronavirus pandemic. We are Healthwatch Enfield, and we've got some wonderful partners here today to support us, which is Age UK Enfield. We also have Barnet, Enfield and Haringey Mental Health Trust. And we also have Mind in Enfield and Barnet supporting us today, who are our specialist speakers. This is our latest online event, one of a series of different topics with partners to answer questions people have raised with us already on a various range of topics. And our next event will be on the 22nd of October on cancer awareness with partners from North Central London Cancer Alliance. So do get in touch for more details. We also have an online evaluation for this meeting. We'll be giving the links in the chat section, so please help us by evaluating so we can improve and do better in further sessions. A special thanks to our partners who have arranged speakers today. And I'd like to introduce each and every one of them. So first we have Farai Zarari, from the practice lead from Chase Farm Hospital. We have Alison Gordon, service manager, social prescribing and head of prevention services. Alex Tamperides, CEO of Mind in Enfield and Barnet, and Alan Beaton, senior service lead, Enfield Mental Health Services for older people. So none of us could have predicted that a virus would result in us being locked down for months, which has had a huge impact on our everyday lives in all areas. What, how and if we can work, educate, socialise, do hobbies, see family and maintain relationships, as well as accessing health and social care services. Like many organisations, we have had to adapt and react rapidly. We've ramped up our communications considerably to ensure that verified and trusted links on local health and social care services are available, as well as national charities, and links are available on our website, social media and other mediums to keep everyone up to date with such fast-moving developments. We also supported Enfield Council by engaging our volunteers in the borough's telephone befriending project, which was an emotional helpline for people who were vulnerable, lonely and isolated. We continue to amplify the voice of local people on health and social care services and have provided a seamless service, we think, throughout the pandemic, albeit from home. So there are challenging times ahead: darker, colder winter months, seasonal flu, Christmas and school holidays. So it's important to look at ways to cope and manage anxiety to get us through the more difficult times, to help us stay positive and manage our mental well-being. We've encouraged people to raise questions for our speakers in advance, and if we get time, we'll try and arrange any in the chat section as well. Obviously, we're all individuals and there is no one-size-fits-all approach to this, as what works one day may not work the next. So please bear this in mind, that a range of strategies, techniques and approaches may be needed. It'll be useful if each of the speakers can update us now on which services are currently running and how they can be accessed. So perhaps, Alison, would you like to start from a perspective of Age UK and let us know what you've been up to and how you've been helping support people in their mental well-being?
Hi everybody, so I'm Alison from Age UK Enfield, and we have slowly started emerging out of lockdown and starting to have in-person services, which has been a really key thing for lots of people who feel really socially isolated. We get lots of requests from people asking us if our groups are starting back up again, to answer that in brief, most of our activities are online, but we do have our Fit for Life classes that are coming back and the walks are back in. So normally we have 24 classes a week and at the moment we have about 9. So with social distancing measures, but just the opportunity for people to actually see each other in person is making a big difference to people. So prior to COVID, we had falls prevention and Hygiene classes in person. We had our memory club in person. We had our daycare services, our home care services, etc. A broad range of services. And again, they're very slowly coming back. We've got a slow emerge of our daycare services. Our home care hasn't stopped throughout the service. Our memory club is online, but we offer a great deal of opportunities for people to connect to one another. And where possible, we try and visit people on their doorsteps. And we're starting to do a bit of home visiting as well. So it's a bit like doing a cha-cha-cha, I feel like, a lot of the time. And when we talk about managing anxiety and stress, there's an awful lot of emphasis placed on managing anxiety and stress of staff as well, as we're trying to manage this very difficult time. I think as Sue's mentioned, one day you're doing one thing, the next day you're doing something else. So the planning is very, very difficult for all of this. So in relation to COVID-19, also for our staff, we developed a wellbeing project where we send out a monthly bulletin and we try and work up different ways to sort of like support people as best possible, and also accessing our partner services in the community.
Yeah, thank you, Alison. I think I've actually attended a few of these sessions to actually engage with different clients as well, and found that it's actually been really useful from a personal perspective as well, listening to other people's, how they've managed, different strategies been put in place. I think Age Concern has done actually brilliant job, so well done, Alison, to you and your team for helping everybody in Enfield through this very difficult time right now. So Farah, would you like to explain about your services and how you're currently running and what you're doing and how people can access them at the moment? Is it online? Is it by phone? How can people actually access services right now?
For me, the services I run is older people acute, which is the inward patient. So we have never closed. They are all running and we are offering the service as usual.
Thank you, Farah. That's really good to hear. And Alex, perhaps you'd like to say from a Mind in Enfield perspective about how things have been running from your angle.
Yeah, thank you. Mind in Enfield's been in Enfield providing services, I think, since 1995. And obviously way before we had any idea that anything like this would be happening. You know, the world was very different then. But we've been providing specialist mental health services since then. What's happened for us and people we're engaging with during COVID is we've continued to provide all of our services. They've just been moved onto remote provision. So that's a combination of working with people on the phone or video conferencing. And we have found that actually, like, interestingly, like a lot of people have found that to be incredibly helpful. So the services we provide is therapy. We run part of the IAPT program, improving access to psychological therapies, which we could talk about a bit later because it helps with anxiety, funnily enough. So we provide that therapy, we provide advocacy, and we also provide a wide range of well-being related services. When the crisis first hit home, we worked with the council to do welfare checks for people with mental health problems in the community. So we were literally outreaching and contacting people, making sure that they weren't in distress and they weren't feeling isolated. But the really good news is that we've worked very closely with the CCG and the borough, and we've managed to create a new service, actually, which is coming online on the 12th of October. I think that's next Monday, and it's called Sanctuary, and it is basically a distress response service. So the idea being that if anyone in the community in Enfield is really feeling that they need to reach out, they need to talk to somebody, their situation is causing them a lot of distress, you can get in touch with us. It's between 5 to 11 every single day. You'll be able to talk to somebody to work through your problems. We can escalate if you require more clinical intervention. But if not, you'll get allocated a one-to-one person who the next day will be able to take you through really looking at what your needs are, helping you plan to work out what you need to do, problem solving, signposting. And we'll also have rolling group activity that happens, I think, on 3 of those evenings during the week. So we'll be publicising that next week, but it's quite new because it's very much a kind of an instant connection you can make with a really kind of expert and trusted service. So that's a good development for us. Lastly, just to say that whilst loads of providers have shifted their services online and most people have adjusted to that in terms of people that are using our services, we do know that there's at least between 15 to 20% of people that need counselling that cannot access counselling online because their domestic situation is a barrier to that in terms of privacy. So I think we've all got to work harder to try and provide some kind of face-to-face or building-based solutions for those people.
That's fantastic, Alex, and do send us details of that so we can help promote that. It sounds a really fantastic service and much needed in the borough, so thank you once again. And Alan, perhaps you'd be kind enough to give us details on reflecting on what Farah's already said regarding your services, please. That'd be helpful.
Hi everyone. So my name is Alan Beaton. I'm the Senior Service Lead within the Enfield division for Barnet, Enfield and Haringey Mental Health Trust. So we provide a wide range of services within Enfield, from children's, adults and older people services across a range of inpatient, outpatient and community provision. And we are pretty much up and running, fully running across all those services. Just like previous speakers have commented, a lot of those services have moved online. And for us, the big thing really has been around managing sort of COVID safety very carefully. So for some patients, it's about a sort of risk-benefit analysis. Do we need people to be seen face-to-face because the investigation or the intervention requires it? The vast majority of, say, community or outpatient can actually be provided remotely within mental health services. And we also have, just to say, we also have within Enfield, within the Mental Health Trust, we manage the community health, physical health services within Enfield as well. So everything from district nursing, lymphedema, tissue viability. So we have all that community provision as well within Enfield. And so every service is different in terms of how it provides a service to patients. But we've got a lot of great thought into, and it's very careful thought into, if people do need to come in for a face-to-face, then what does that look like? So gone are the waiting rooms. People don't wait about in rooms, packed in for long periods of time waiting on appointments. We've had to space them out, stagger appointments within departments, and make sure people come in fairly quickly straight into the appointment. And you know, with protective equipment, etc. And you'll see that whether you're looking at attending an appointment within an acute trust or a mental health trust, any secondary provision or primary care even. Many of you have experienced that. But again, just to say, yeah, all services are up and running, but it's just how they work now that's slightly different within these COVID times.
Thank you. That's really good. I think because what people have expressed to us is a fear generally of, are the services there? Can they be accessed? How can I access them? Will I be at risk? And that's a thread that's come through many of our seminars, if you like. When we had the GP seminar, the flu jab seminar, all of these fears were kind of bubbling around that. And it's about reassuring people that there are mechanisms in place to keep them and the staff safe as well, because ultimately it's about looking after each other, isn't it? Making sure that we're all kept as safe as absolutely humanly possible, while still retaining those services and being able to offer something that people obviously need, and maintaining their health as well, which is really important. That leads very nicely onto one of my queries, which is questions, actually. So one of the questions we have is around, one moment, is around how do I manage anxiety when going to medical appointments? And I know you alluded to that slightly, Alan, where you were saying about keeping, then there's no waiting rooms, keeping the appointments to a minimum, staggering them, and so on. But if people are very anxious about actually going to the appointment, it could be the travelling part of it, it could be the actual getting out the front door, it could be, can I go with somebody? Can I have someone translate for me? There's so many different elements to this. That people really don't know the answer to. There's no booklet, if you like, to say this is what you do when you go to an appointment. And I think that's where people are a bit unsure, and they see things on social media. They hear things that perhaps a lot of fake news out there, a lot of fear mongering, which is why I think from a Healthwatch perspective, we are so keen to make sure that we only deal in facts. We don't speculate. We only look at verified sources and only give links to those, because it's so important to have that tried and trusted information available to people, because there is such a lot out there that isn't actually factual or real. So that's a really important question, is how do I manage my anxiety? Because people may get an appointment in the post, or they may get a text and say, you need to come in to do X, Y, and Z. And that could be a mental health service. It could be any type of service. But how do they manage that anxiety? And perhaps I'll throw that over to Alex. What would you suggest if somebody says to you, I need to go to an appointment and I'm really anxious about it, what can I do? What information would you suggest that they consider?
So the first thing is what I can't do is give advice around the physical aspects of COVID and so on. So all I would say on that is do make sure you're appraised via the right information sources, like government websites and so on, around what steps to take to safeguard your health. Your fears or anxieties around your health are different though in that regard. And I mean, I could talk for hours on anxiety, so I'll try and make it quite brief and in fact quite specific to the question. What I would say is that with anxiety, there's usually a collection of certain fears that you have about a particular topic. And what can often happen with that is those fears can run around your head and really start to interfere with your thinking, how you're engaging in life generally, your emotions, and so on. So, but one of the key things to do with anxiety is to sort of learn how to actually manage those anxious thoughts and in fact, in some ways, contain them. And one of the most useful things that you can do, I mean, there's a lot more than what I'm about to mention, but one of the things that you can do that people find very useful is to write down those thoughts. And what a lot of people with anxiety do is for a coping mechanism is they actually use a journal. So they'll write down the things that are worrying them. And then that allows you to gain a sense of order, a sense of control and containment around the things that you're feeling anxious about. Now, in this case, what I would do is if you've got this letter, you need to go for an appointment, is actually have a think, what is it that you are worried about? What is it that you're anxious about? What are those anxieties? Write them down. And then if they are not too personal, they're more logistical or practically orientated worries, I would actually ring the place that has actually offered you that appointment and discuss some of those anxieties with them. If you're concerned about safety, for example, in the building or accessing that service, then write down precisely what those concerns are and raise it with them. Don't be afraid to do that. It's absolutely your right when accessing public services to make sure that they're suitable for you, which is something I know that probably others would agree on. So I would put your fears down and actually call the place that's offering you the appointment and go from there. There are a host of other things you can do about anxiety generally, but rather than go into that, I'll just leave it there being specific for the moment.
Thank you, Alex. And anybody else like to add to that at all in the panel? And it's something that I know that we've got a lot of calls about, is about anxiety, and even from a personal perspective, my parents find it very hard and don't know whether they should go because they were deemed as extremely vulnerable. And we've talked about this, how if they're not sure, they should ring up and check with them and say, what is the process? What do I need to know? So when I get there, I can feel confident and I will want to come to my appointment. So you hit the nail on the head there, Alex. It's definitely more about making sure you feel confident to go to that appointment and that you feel reassured that it's safe for you to do so. And I think, once you speak to the health professionals, they'd be more than willing to make sure that you can do that as well. That's really important. They want people to come to these appointments. It's really important they do. So any means of getting people to go to necessary appointments is really important. Thank you.
Jane. Hi, Alan here. I just, the other thing you'll notice with a lot of services where there is a more involved process around, say, the patient coming in face-to-face, particular treatments, the services will, depending on the type of service, might phone up the patient to actually gauge, well, sometimes it's to gauge what can be done online or virtually. Not everything can be done online or virtually, obviously, depending on the issue. But they will gauge that. So it's about the risk-benefit analysis that they'll do and and see. And when people are coming in, that's then the prime opportunity, as Alex said, to really ask those questions. And there's no stupid questions. They're used to all these questions. They're used to being asked constant questions about COVID, because the rules are changing all the time and so frequently as well. So they're used to that. And, you know, we have 3 teleconferences a day where we're looking at our COVID guidance, our information, our services, how they're operating in these COVID times. So there's a lot of planning that goes into it and thought that goes into it. So services should reach out where there are sort of more complex processes or it requires face-to-face. They'll reach out to provide that reassurance as well.
Fantastic.
Following on, sorry,
Yes, please.
Following on from Alan's point as well, we tend to offer telephone conversation before the individual comes, so that their time is minimized when they are on clinics or when they are being seen, instead of, say, spending an hour. Say you are coming for one particular thing, then we can do the assessment prior coming to minimize the time. And also you can think about your traveling time, the distance, and also follow the guidelines. Wear your face mask, clean your hands in between touching things, and keep your distance.
Thank you for really, really good information there. I think just to remind us how important it is to do all of those really important things. So yes, and following on from that, we've got one around, do fears and anxieties relating to COVID-19 tend to be more specific or more generalised? It's quite an interesting question. I mean, it's saying, I suppose it's saying, are people focusing just on COVID-19, or is it wider than that and they're just getting more anxious generally? Is that something you've found, that there's that heightened anxiety is not just around COVID, but it's impacting on other areas of people's lives and other areas of concern? Shall I put that to Alan?
Yeah, I think a lot of what we've experienced is it's COVID. Yeah, there's anxieties related specifically to COVID, but also there's anxieties related to how this is going to affect people's access to services and treatment and follow-up and support. So I think it is wider than just will I contract COVID and what will happen to me? Fear about the actual infection itself. But I mean, I'm not sure about the wider elements. I'm not a clinician myself, so but the in terms of, I'm not a practicing clinician, that is anyway. But there will be wider issues, I would expect, and maybe other members of the panel may be better placed to comment on that. Alison, for example, or Alex. Yeah,
just to jump in, I mean, we're experiencing people having a lot of anxiety about losing jobs and their housing situations. So, lots of concerns about that, concerns about family members. We've had concerns from family members when lockdown first started. We'd have people phoning us from Australia and Thailand and different places where they're concerned about people that they care for and they couldn't get to see them. We'd have concerns about people who had dementia and they had go out into the community and their family members would be really distressed that they'd be out thinking they're taking risks, or family members coming in and bringing the virus into the house. I mean, it's just been absolutely everything and everything, really. I think there's been concerns about lots of things, and I think the uncertainty is what's breeding a lot of anxiety for many people. There seems to be no end to it and no limit, and I guess if you've got an underlying anxiety prior to having it, or a health anxiety prior to having this whole pandemic, it's affecting people in so many different ways.
Thank you, Alison. I think that's really helpful. And I think you're right. I think people have struggled with the impact, as well as not just the actual COVID itself, it's the impact that it's had on their everyday lives, which I alluded to earlier, around impacting their relationships, it's impacting on their work facility, how they manage work. I mean, none of us expect to be in their kitchens, conservatories and lounges doing work. You would never dreamt that, a few months ago that we'd all be working from home, and it's a very different animal working from home. It's getting that social isolation. I think even just for people that are working can be quite difficult to manage as well. Alex, do you want to add to that?
Yeah, I mean, I think that it's actually So the thing is that it's with anxiety, like a lot of different states of mind or mental health problems, it's something that starts off specific can actually become more general over time. And I think Alison is absolutely spot on in terms of what some people will refer to as the socioeconomic factors at the moment. People are worried about their jobs, the intensity of relationships with children, with loved ones, and so on. There has absolutely been a general increase in mental health in prevalence of mental health problems in society. That is proven beyond a shadow of doubt. Figures that were done as going as far back as, I think, April or May showed there'd been an increase in the general population of about 10% of mental health problems. It will be far higher than that, to be honest with you. But luckily, you know, the means of addressing and treating and coping with anxiety have been, you know, people have been studying that and providing services around that for decades. So there are really, really good proven ways out there of actually dealing with anxiety that people were using before COVID. And actually, even though COVID has changed our lives, the way that you can deal with anxiety is very similar to how it was before. So there's a lot of real positives out there in terms of how we can address it.
Thank you. Thank you so much. I've got a couple of questions now. You were mentioning about going back to work and people fearing about their job situation and how that can impact both economically and otherwise and their mental well-being. So I'll run those first of all, and they're kind of, I'll do them in a group. It's how do I manage anxiety when returning to work? What must employers do to make it safe? So I'm guessing they've been furloughed. They're now going back to work and are very anxious about doing so, not sure whether the environment is going to be safe for them, how it's going to work with their colleagues, how they're going to have to travel, and the whole range of elements involved in going back to work when you were in your little bubble at home and felt quite secure and quite safe in many ways. But going back to work is very different, and you're having to access public services, public amenities. How do you manage that and manage your anxiety when going back to work? Any thoughts on that, panel? Alex?
Yeah, so the first thing is that actually it's an important point to recognise that some people, not everybody became more anxious when COVID started. Some people became less anxious. And that's because the hyperactive society that we all got used to started to die down a little bit and became a bit calmer in one way or another. And actually what's happened is a lot of people adjusted whatever their starting point was to a normalized routine of remote working. And there is anxiety for lots of people about going back to work. And the longer you become away from something like that, the more anxiety inducing it becomes. If you've actually been to if you've actually sought help around your anxiety and it's something that's having a significant impact on your day-to-day life, if you were to disclose that to your employer upon your return to work, they are bound by law under the Equalities Act to make something called reasonable adjustments. They don't have from an ethical perspective, or rather they do from an ethical perspective, but they literally, legally have to make reasonable adjustments for you in terms of your return to work. So from that perspective, although it's difficult, I would advise, if you feel confident in doing so, to disclose how you're feeling to HR or your line manager, and try and have a constructive discussion about that. If you're not feeling confident about that, then I would definitely try and seek support from different services that are in the borough who would be able to help you have that conversation and navigate your way back to work. The general thing I would say though is do one of those two things. Don't try and do it alone, because there is support out there and it will help.
Thank you, Alex. And I think maybe people that have never had anxiety before may now be actually suffering with anxiety levels that they had never experienced. And it can be quite a scary thing. It's like, well, I don't know what to do. I've not been in the system before. I've never experienced this. I've never had to deal with this before. And they may feel that whole sort of shame factor, that embarrassment factor, don't want to talk about it. There's still that mental health stigma, I think, that then people have to deal with that, as well as their own emotions and feelings throughout this. So I think it is difficult, but I think you're right. If you get support from other people, you're not on your own trying to do this and going through this on your own. I think that's really useful. And following on from that, it says, how do I recognise anxiety and stress within my team? Because you mentioned about people talking to you, but if they don't talk, what are the signs? What should you look out for in your team? People showing anxiety or showing some form of they're not their normal selves anymore. How can you help support that? And what should we be looking out for? What are the signs?
I promise I'll shut up after this, but I feel I should speak because I've basically been training Enfield Council on this topic for the last 2 months. So I've been working with their managers, leaders, and frontline staff on exactly this. In terms of how you spot whether something is going on amongst your staff, amongst your colleagues, families and friends. If you think about it from the workplace specifically, there's 2 ways to tell. The first is just a change in behaviour of any kind. So the person always had their camera on a Teams meeting that doesn't have their camera on anymore. The person that didn't have it on and now has it on, and there's something different about how they're behaving or appearing. People that are retreating from social interaction, people that are actually vocalizing fears and stresses much more than they were before. Any kind of change in behavior could indicate that actually it may be that their mental health is under pressure. But the other way of telling if something could be up in the workplace is that everybody has tasks to complete in one way or another through their job, and it may be that their mental health is impacting their ability to do that. So you've got 2 ways of noticing. One is what's happening in the person themselves, and 2, what's happening in their work. And as a manager, you're not going to be able to notice any of those things if you're not creating the opportunity to do so. So one-to-one supervisions, regular team meetings, regular catch-ups needs to be far more regular than it was pre-COVID. I'll be quiet now because I'm really speaking too much.
No, it's really useful to hear that, because at the end of the day, people are returning back to work now and often don't know what to do. And also managers may not have had to experience this type of situation before. So again, and Alison, you had something to say?
Yeah, just to add to what Alex said, which is fabulous, and we could all dealt with that, at the beginning. It would have been great if you'd been speaking to all of us as well. It is very difficult, and trying to find a balance. And one of the things I think is anxiety is the communication levels have changed with people. So we know we need to talk to people more, but for some people that's overwhelming too. And how much is the right information you're giving people? How much is too little information you're giving people? And everyone's got their own level of acceptance of things. So it's a really fine balance. But I completely agree with what Alex said there. And a lot of it's about what people are not saying, but what they're showing. And I totally agree with the change of personalities. And I think lots of people now, as we're 6 months in, are really starting to struggle. And it's been in waves, hasn't it, as we've gone on. And at first, I think people felt very burnt out at the beginning, then settled into a bit of a norm. And then there's been a spike again as it's gone on, and people are not sure. Again, this whole feeling of uncertainty just breeds a lot. So I think, as a manager, it's about talking to us, and if you can't talk to one of us, then if you've got a helpline or somebody else that you can contact, or an HR department. We're a very small charity, so a lot of the time we have to rely on our external partners to be able to support some of our staff and things. So if you don't feel confident speaking to a line manager, speak to somebody else you trust, but definitely speak to somebody. And Alex mentions IAPT and those kind of services too. So there's a lot out there. It's just about sort of doing something about it rather than feeling too ashamed to do something about it. It's completely normal.
Thank you, Alison. That's great. Another one is how to change your mindset when working from home to support the family, because suddenly you become, you have several hats in your home. You're suddenly not just the parent and the partner and the carer and the worker. You're suddenly all of those things, but in one environment. And it can be quite overwhelming because you're trying to juggle your pets, your family, your children, your other needs and other responsibilities, and you can't get away from it in the way that perhaps you could when you went to work in the old days, if you like, where you'd go away from work for a time and you'd come home and then, you know, you'd spend a little bit of time together, but you're quite compressed and you're with people a lot of the time. I call it the Christmas syndrome, where you spend a lot of time at Christmas with your families and there's often a row. You know, you often end up rowing with each other because you're not used to spending that sort of time together. So for me, it's how do you manage that mindset when you're working from home, that you are working, you're focusing on that, but you're also still those people with those other hats in that room. How do you manage that balance? Because I think that's where a lot of us have struggled with that. It's been quite difficult, and I don't think any of us have got it quite right yet, and we're all sort of experiencing good days and bad days with that, where you've got the dog running through, you've got children demanding your attention in the middle of a Zoom meeting, so on and so forth. So any hints and tips on how people can actually work with this situation in a way that they can still be all those hats but actually maintain their mental well-being and balance, if you like? Anyone would like to respond to that?
I'll kick off and then I'll let Alex, you know, help me out here, because I feel like I'm living that experience myself, and we're quite lucky my dog hasn't bombarded this Zoom meeting today, which she normally does. What I've found is that because we are working from home and we don't have the commute used to be quite helpful in either preparing for the day or shutting off for the day. And when you're working from home, you kind of don't have that. You kind of wake up and you can be a real slob and just have your pajamas on and switch your computer on straight away, or work over in the evening. And it's easy to leave your phone pinging. And there's members of my team here who do that, leave their phones on and they're answering messages on the time when they shouldn't be. So it's about kind of sticking to boundaries, and maybe having a manager who nags you about sticking to your boundaries, and maybe having people that manage you, so nagging you about your boundaries. And it's really hard. But I think probably the best thing is really about being kind to yourself. And that sounds a bit silly, I guess, but it's like, you know, don't beat yourself up if you do have a day where you overwork, and don't beat yourself up if you can't manage to do the things you're expecting to do. Kind of lower your expectations a bit, because my house doesn't look like it did before I went to work, because effectively I've got my office in my front room now, and my front room, you know, as it has become an office, a place where I relax. You know, it was at some point a place where I exercised as well when we weren't able to go to places. So it's very, very difficult. And I think sometimes we add extra pressure on ourselves, thinking we do have to be everything to everyone. And I guess more than anything, it's about maybe finding some time for like this mindfulness practice, but without making that another thing on your list to do. So trying to incorporate it into, you know, that old famous thing, Alex is laughing at me, I'm sure, about, you know, washing up mindfully or walking the dog mindfully, you know, trying to incorporate it into what you're doing rather than it being another thing on your list. Alex, take over, tell me.
I was laughing because I think that I practice mindfulness, and I'm one of those people that rigidly tries to do it every day. So it is a bit of a to-do list thing. So there's an irony there. But just to echo something you said, which I think is really important, Alison, and it's not spoken about enough. But the self-critic and the which is basically kind of an internalized bit of society's stigma, and all sorts of other things. But the constant self-criticizing that we do, we just need to try and find a way to get rid of that. And the key to that is by being kind to yourself. There are loads of exercises that you can do on that. Those are things you can read up on it. It sounds simple, but, you know, like Alison says, but it's actually far more difficult than you might think. And I think that one thing I would love it if everybody could realize is that your mental health is very similar to your physical health. We wouldn't expect to get physically fitter without exercise and good diet and so on. And we do have to treat our mental health in the same way. So things like self-compassion, we need practice to do that. And there's loads of information out there online to do it. And I guess just to finish on one point is that when you work in mental health, one of the things that you're schooled in is boundaries. You're always taught, you're always supervised and managed within an inch of your life to be careful around boundaries. And I think in a situation where you're working from home, boundaries is so, so important. And boundaries are things that can be physical, they can be technological, or they can be psychological. But what boundaries do is they protect you from getting dragged physically and mentally and emotionally into spaces that you shouldn't be in order to protect your well-being. They help you to be clearer, and they help you and other people around you to be less confused. So in a home working situation, there are things that you can draw, there are ways that you can draw boundaries that are technological. Your computer, turn it off after a certain time. If you have notifications on your phone, turn off your notifications. Do not let your phone drag you into it, and do not let your computer beep at you after 6 o'clock. And those are technological. There's physical things you can do. So I know that there are some people that instead of the walk to work and the walk from work, they just go out for a walk in the morning, which symbolizes the start and the end of the day. And then on the sort of more psychological or emotional part of it, it's worth having a conversation with people about this topic. You know, when I'm working, I am working. You can't just barge into my office and expect me to do this with you for half an hour, because you wouldn't do pre-COVID. You can't do it now either. And I think, and I know it, like, I've got kids, so it's not always that simple. But I think that the conversations do need to be had, rather than sometimes, I think, particularly in our society, we have a temptation to just sort of muddle along. I think we need to talk about those boundaries and draw them, because they benefit everyone.
Thank you, Alex. Some great little tips there. I think myself and others will need to actually benefit from those, to be honest, because it is difficult. I mean, when you're in a profession where you help people, it's really hard to switch off sometimes, because that's your reason for being. You want to help people and you want to make lives better, basically. So it's quite hard to sort of think, well, I'm switching off now. I'm finished for the day. So it can be difficult. So I appreciate that. So thank you very much for that feedback. We've also had another question that says, it's more about tips for how do you keep your mind in the present? We mentioned mindfulness, and I think you can ruminate about the future. You can ruminate what's going to happen next year, because we all know that things are changing fast and it's quite hard to keep up, like has been mentioned by Alan and others already. But how do we stop that constant ruminating where we're worrying about the longer term future? What will happen to me? What will happen to my people that I care for? You know, am I going to catch COVID? All of those things that you're looking in the future quite a way ahead. How do you manage that and keep yourself grounded in the now and here and now? Any hints or tips for that, anybody, that we can share with the group? Alex. Giving me the thumbs up. I love it. Thank you.
I'm really sorry.
I love it. Carry on, please. You know, you're giving some great tips. Thank you.
So there's something called the 5 ways of well-being, and it's basically, there are 5 scientifically evidence-based activities that you can do, and if you do them regularly, a bit like your 5 fruit and veg a day, if you do these things regularly, then you will be more mentally resilient, more mentally healthy. You'll be able to recover more quickly, and you'll be able to prevent mental health issues with greater efficacy. And those 5 things are be connected, which is about connecting with other people socially. Stay active, so that's exercising. Keep learning, so doing anything to get the grey cells turning over. Give, which is basically about altruism, doing kind things for other people, but we should include yourself. And finally, something called take notice. So it's scientifically evidenced that basically by doing something called taking notice, which is really practices and activities that keep you in the present, it's absolutely true to say that will make you more mentally healthy and more happy. A simple way to look at anxiety is that it's about being trapped in the future, and a way of looking at depression is that you're actually trapped in the past. And you're at your most healthy and your most happy when you're in the present. And one of the ways to do that is through mindfulness. And doing mindfulness has never been easier than at any other point in history. Okay? It's never been easier to do it. And just doing it as much as 5 to 10 minutes a day will make a massive difference to you. I can show you something. I think if you can, my video is on. So can you all see that? That's my phone, okay? And there's an app on it. And the app is called Insight Timer. It's free. And like, it's completely free. It's not, you know, And on it, you've got guided meditation from countless really, really good people. So you just need to stick your phones on and sit and learn to find that calm space. And essentially, the net result of mindfulness practice is learning to live with and accommodate and have perspective on your thoughts and your emotions rather than being overcome by them. And again, what I would say is that if you can, as you can tell, I'm quite evangelical about mindfulness, but I mean, it's a practice which is literally a couple of thousand years old or even older than that, but it's still relevant today. The approach to take with it is the same approach I would take with something like jogging, exercise, yoga, or even learning chess. It won't be pleasant to begin with. You won't like it in the beginning. Don't think it's going to be amazing in your first session. It won't be. But keep at it, keep doing it. And honestly, the benefits are incredible. And it's a great antidote to anxiety.
Alex, can you remind us what the app was called again, please?
Insight Timer.
Insight, INSIGHT timer, like that.
Yeah, Insight Timer. There's another one called Headspace, which is good, but there's a monthly...
There's a charge, yeah.
And then on Spotify, they've also got quite a few mindfulness books. Shop around a little bit. It's a bit like finding a decent therapist. You won't chime in and resonate with every talk, every person. But it's really good to do. But please do analogize it with physical activities, because there'll be a bit of resistance to begin with.
And also we have on our website, we do have links for the Kobit links, for things like mental health support and things like what to do and things to do, often free, because obviously you need to keep yourself busy and your mind active, otherwise you can ruminate. Alison, you're going to say? Yeah,
just one more thing, and I think Alex might agree with this one as well, is that set worrying time, where you have a timer limit to it. Yeah, it's a great one, isn't it? And just that bit where, it's okay to worry about things, that's fine, but don't let it take over the whole day. So like set yourself an actual physical alarm. And I read this amazing book once, The Happiness Trap, and it says his name, Ross Hurd, I can't remember his name. And it's like acceptance and commitment therapy. And it also will tell you to sort of distract yourself from things by using a silly voice or sing out loud. And it really does work. It sounds a bit bizarre. So if anyone in my office ever hears me do that, it's what I'm doing. I'm stopping myself from sort of like thinking about things after a limited period of time. But I think that there's a real benefit for, allowing yourself to feel what you feel. There's no point stifling things, but limiting the amount of time that you do that.
Lovely, thank you. One question is, how do I deal with the lack of sleep? Because obviously if people are anxious, worried, or just a change of routine, I think, we've all had our lives turned upside down, inside out. The changes have had an impact on our ability to sleep and relax. So any hints on how to deal with the lack of sleep? Not all of us can nap in the middle of the day, obviously. So any hints or tips on how we can manage that, please? Alex?
Sorry.
Or Farah, would you like to say something?
Yeah. Sleep hygiene really help. By sleep hygiene, I mean that you have to take into account what is it that preventing you from sleep. Are you able to solve it? Suppose you are not able to solve it. Things that can help is exercise. One thing, if you exercise, you have a routine time of exercising, it will help to condition your body. And sometimes when you are tired, you feel you can be able to sleep. And also you look through into the problem. Are you able to solve whatever it is troubling you? If you are not, then you can talk to someone. It could be someone whom you trust. It could be someone whom you can have professional counseling with regarding, depending with how big the problem is. Suppose if it is related to COVID, also you go back to the recommendations as usual of what, the things that you can do and things that you can be in a position to make you more look into the actual issue. And also talking to someone can help, because you'll be able to explore. They can also guide you, and also you might even discover you are not alone. Other people are in the same boat, and also you can get involved in something that interest you more, or get involved in something new. When something new, you'll be able to learn more things, you'll be able to get focused from your issue. And sometimes, say you are unable to sleep, you make a pattern of your sleep times. Is it early in the morning, or is it or isn't it? So if, say for example, you are being forced to wake up so early, so you can look to change your time. Say you go to bed a little bit late than usual, but at the same time as well, you can make a note: are you in a position to sleep at any time or anyhow? Sometimes you can sleep, say, during the day, then when it comes to night, you can't sleep, and then you think you are not sleeping. Is it the case of your reverse patterns, or is it a real issue for you not able to sleep? And also look into the actual hours. Sometimes for an adult, the recommended sleeping time is about 7 hours. So if you are sleeping during the day and you kind of know, okay, my time is more, and I'm unable to sleep during the night, so you look into changing your reverse pattern, and also to do something which is more interesting. And the other things is not to go to bed with full stomach, because obvious that can upset you, that can make you sleep not being able, to be in the right pattern for you to sleep. And another thing is to avoid the obvious things, which are like alcohol or tobacco, or things that can that do have caffeine, because caffeine can disturb your sleeping pattern, can induce you to be awake.
Thank you, Farah. I think if people are already doing, like Alex suggested, is doing the diary, actually diarising how you're feeling and how you're doing, maybe diarise about your sleep as well, might be a good way of actually just analysing if there's, if you're napping during the day, is it affecting your sleep at night? Is there a pattern emerging here? It might help if you're already doing that to actually just add that in, might be something useful. And going on to, sorry, Alex, yes.
Yeah, I think this is a really important one. Farah mentioned the phrase sleep hygiene, and I think it's really important to analyse this, to analogize this to standard hygiene. Like, nobody would find it good to sort of, in terms of physical health, hygiene and tightness, to leave loads of pizza boxes and uneaten food all over the floor, to not hoover or clean for weeks on end and let things just run into a terrible sort of state. But we do the same with our sleep. And there are really, there are some key things that are important. Your phone is your enemy in terms of sleep. It really is. Even if you've got blue light turned off on your phone, which is a setting that you can do. So look at that. There's a setting on your phone where you can turn off blue light, which basically is anti-sleep. But you can put in place boundaries to mean, like, say, not looking at your phone at all for within an hour of you going to sleep, making sure that there's a clearly delineated physical separation between where you sleep and where you work. And also actively trying to relax before you go to sleep. That could be the opposite of stimulation. It could mean watching some absolute pap on television, something that's not going to challenge you or stimulate you in any way. Reading a book that's utterly dull, that will literally send you to sleep. Like it's just that sort of thing. There's a push and pull relationship with sleep as well. The more you want to go to sleep, the harder it is to do it. So anything you can do to relax you and sort of turn your mind off is a good idea.
Thank you, Alex. That's brilliant. I've got a couple of questions around actual mental health services, so perhaps Alan and Farah might be able to help with these. What arrangements have been made to improve availability of mental health services to meet the growing need? Obviously, it's a tricky one. And about face-to-face support as well, which I think you touched on. And about IAPT waiting times as well, about counselling services and how are they under pressure and how are they managing and how do people access them? Because people haven't heard perhaps back from the service and didn't know if there's a lead-in time or waiting time for that. So Alan or Farah, would you like to answer those ones for me?
Yeah, so in terms of services and having capacity for services over the years, certainly this year what we're looking at is some monies coming around transformation. So there's the NHS long-term plan, which is a key document for services in terms of how it's developing. So locally within Enfield, we're looking at, and it's happening across the Trust in Barnet and Haringey as well, and nationally, looking at how services are offered. And there is a risk sometimes with the groups of services we have, as like physical health, mental health also, you have increasing specialties, increasing specialisation. So you have lots of different departments that do different things or meet different needs for people. And sometimes that can cause barriers and silo working. And it's very difficult to move sometimes between services. So some of the work we are doing at the moment is looking at community adult and community older people services and how they can be arranged in the best way, integrated with primary care, aligned with primary care, and also opened up around, integration with social services and third sector, voluntary organisations, for example. So some of that work is really just starting locally within Enfield, although there have been discussions going on for a good while. With that long-term plan, there are some additional monies coming to support transformation, and there's lots of tools. I mean, just like COVID has accelerated the online working, that should help around capacity and flexibility in seeing patients. If you look at some of the demographics, I mean, the numbers in terms of older people that are going to be within the next 10, 20 years, significant increases in older people and the very old. That's going to put huge demand on old age services, as well as other services within localities like residential homes, etc. So there's planning that goes into that on a much sort of wider scale around what services are required, and that gets refreshed every year in terms of what the government strategy is that supports the development of NHS services. So I mean, I think what I said before, there is access to face-to-face services, so if people do need to access services, then they can. But obviously we try and do things remotely if that helps to reduce risk in some way. Sorry, Sue Jane, what was the other?
It was around waiting times for getting counselling and support. Is there, obviously because of lockdown and other situations and the increase of need, has there been an increased waiting time to get counselling and support that you're aware of?
I'm not aware, because we don't manage within our division IAPT, although we have IAPT in Enfield obviously, but Alex may be better able to comment around the IAPT aspect, because I'm not sure of any. I don't think there's any waiting times in terms of immediate access, but Alex, do you know of it?
Yeah, they've gone down. Like what happened in terms of generally all mental health services, both secondary and primary, so specialised services in psychiatric units, but also IAPTs, is when COVID first hit, actually we saw across the board a massive reduction in numbers of people accessing those services. A lot of that was because people's lives suddenly had other priorities in them. But also a lot of that was fear and reticence to go to hospital and to go to services. So what that meant is for a lot of service providers actually managed to, during that period, start reducing their waiting lists. And so a lot of providers have now got lower waiting lists than before, although that is starting to creep back up because, as I mentioned earlier on, the general prevalence of mental health issues in society is now increasing again. So we'll probably return back to the length of waiting list that we had pre-COVID soon.
So if someone hasn't heard, should they wait a period of weeks, or how long should they wait until they chase up their appointment? What would you suggest?
Chase up immediately. I think I would encourage any. I'm a service provider myself, so we in partnership with other voluntary sector organisations need to see about 650 people a year through our IAPT service. But if you're wondering what's happening to your appointment, and ironically you're anxious about it, ring the provider, ring them up. Do not be afraid to advocate for yourself. Do not be afraid to complain, to phone, to send emails. Do it. It's your right. It's your services, your money. So ring.
Thank you. That's great. And one person has said about they've been signed off work with severe depression and anxiety because their bosses insisted they go back to work, and they have health issues. We mentioned about having reasonable adjustment already. We've mentioned about dealing with that anxiety and talking to that boss. But I think a lot of people are quite fearful now because it's like this, the job market is awash with people that are desperate for employment because of losing their jobs for a variety of reasons. So it'd be useful to know, apart from obviously contacting unions if they have them, which I think has already been mentioned in the chat, and having a word with your employer and perhaps your GP. Is there any other thoughts or tips on how they can manage that anxiety about having to go back, otherwise they fear they may lose their jobs?
Yeah, I think, I certainly think talking through with, and I've got sort of personal experience with friends who've been anxious about going back to work who are not in NHS or health services, for example, who maybe don't have the same access or had access to information, or their organisations or companies have not provided information. And really there's, a requirement on organisations that they provide that assurance to employees that that they are meeting the requirements around being, COVID secure, if you like, in terms of, support to individual employees. So I think that would be the very first thing I'd ask them to do, to make sure that that employer has provided that assurance and what information. Obviously HR, occupational health, GP, depending on individual circumstances and size of organisation, would be the next stage or next step if there were still concerns.
Okay, thank you very much. And I want to also say there's lots of positive stuff happening out there. There's some amazing community work. Community groups have stepped up massively. Volunteers have stepped into the breach to do some fantastic work in the borough. And I just want to raise that, that this has happened as a result of COVID. So some good stuff does come out of disaster, if you like, or bad things. And, that is still very much prevalent and very much still alive and kicking. So there is a lot of support out there on a non-professional level. But if you just needed extra support, there is help out there from community groups, churches, faith groups, a whole load of help and support out there available, often without cost as well. So it's worth doing some research, or contact us at Healthwatch Enfield. We can help direct you into the right places to know where you can access these services and support, and to not be afraid to ask for it. I think it's really important. So we had a couple of queries regards to if they were people were locked down, how would they get food and so on and so forth. And Alison and I know all too well about this because doing the telephone befriending, this was a big issue. It's not necessarily to do with mental health, but it's more about anxiety on practical terms. So absolutely, there is help and support out there. And also there's shops that you can actually ring up now, and you don't have to have an online presence to get food. I don't want to promote anyone in particular, but I know Morrison's do that for vulnerable people. You can just ring up and place an order over the phone. And there are ways of getting food from communities as well. They will actually bring food to your house. Other ways of doing it over the phone are some wholesalers are delivering now to households they've never done before. There is a lot of help and support out there, and we do have that information. I know Age UK does as well, because they were doing a lot of work around that. Alison, anything you want to add to that around the practical side of things? I know we're running out of time. It's now 12:06, so we'll need to kind of wrap this up fairly soon. But I'd love your perspective on just the practicalities of being, if you had to self-isolate right now.
Just that last time round, we had to put things together very, very quickly, and it was a tremendous response from the whole of the grassroots organisations, community faith groups, LBE. A really great task force we put together. Lots of support for people. And we're asking those questions again about what would happen if we were to have local lockdowns. So we're starting to compile lists again about people that are around for food banks and different things in different ways. So it's like contact us or contact other members of the VCS, and we'll have that details together. But we're starting to sort of collate that and having those discussions to reassure everybody. The borough still meets with its COVID resistance groups and planning, so people aren't just letting it drift. It's in the front of everyone's mind all the time. But if you're in doubt about anything, then just contact anybody. Just come back to us and have a chat, and we'll see what we can do.
Fantastic. And we also had one question about the track and trace app, asking about, is there a way of verifying the information received? Because I don't go out much, and if I was told that I had to isolate, how could I prove that? That's a tricky one, and obviously something perhaps we need to do some more research into. So we'll look at that and put something on our website if we can about updating people on that. In regards to the flu jab, there was a question as to, I've had the flu jab now, will it dissipate by next year? How long does it last? So again, we'll do some more research around that. Normally you have a flu jab every year in Haringey. Yes.
If you have a shot, it offers protection for at least 6 months, and this should take you through the flu season. And also the flu jab can be only given annually. You can't have it more than twice.
No, that's perfect. Thank you. Thank you for clarifying that. And we're going to have to wrap up shortly, but don't forget we do have our survey on how you thought the meeting went today. I just want to say a massive, massive thanks to all our speakers. Is there anything else any of you'd like to add before we do go? Because you've been fantastic in giving us all this information. Anything you'd like to tell us about? I know Alex, you told us about this amazing service, the sanctuary service starting on the 12th. Alison or Farai or Alan, would you like to add anything about your services that you are providing right now, or would like to just remind people about?
And we've got this massive range of online activities that we always want to expand, and we're always looking for volunteers. So have a conversation with us, pick up the phone or email us. We're quite happy to talk about anything. If you've got ideas, we're always grateful to hear them. And any way we can.
Thank you. And Farai, you'd like to add?
Yeah, it is very important to stay connected with others, digital or face-to-face if you can. If you have got any concerns, no matter how small they can be, talk to your colleagues, talk to your manager. Don't bottle your feelings in, because if you bottle them, then they can mount to something bigger. So always stay connected with others and explore and talk about how you feel genuinely.
Thank you, Farah. And Alan, anything to add finally?
Not much. I think we've got the Barnet, Enfield and Haringey mental health website for any information, which we can I can post here, or people have access to it. You can Google it easy enough. There's a range of services there. And yeah, I think just the point that everybody's mentioned, don't be shy about phoning people up and asking for advice. That's what they're there for. And there's a lot of good advice from all the groups of services that can provide some support. So please do pick up the phone or get in contact.
Thank you. I think that's just a really nice way of ending the meeting today. I think you've all succinctly said everything you need to say, and I hope that's been useful to everybody here. Please give us your feedback. We'd love to hear from you, and don't forget, Healthwatch Enfield is here to help and support you as well. If you need to know where to go and get help for services, we can always point you in the right direction. And if you want to complain or compliment a service, we'd love to hear your compliments too. Please do let us know, because there's some fantastic work being done out there. Some people, it can be quick to complain about things and not quite so with the compliments. We love to hear the compliments too, so please send them to us. We'd love to hear good service you've received, fantastic support you've had. It just makes our day, and we love to actually promote it so others can hear about great things that are happening out there. So thank you all once again. Any last questions from anybody? I think we've covered almost everything. And don't forget, our next session's on the 22nd. It's all about cancer awareness with the North Central London Cancer Alliance. So hopefully you'll come along to that as well and join us for that session. So thank you once again, and look forward to seeing you in one of our other webinars. Thank you and goodbye. Thank you.